Hi, everyone. Today we're going to talk about influences on therapeutic communication. So, first, let's take a look at just therapeutic communication. What is therapeutic communication? Well, what it is it's the interaction that takes place between a provider and a client. And its purpose is to enhance both the physical and emotional needs of the client. It is, in fact, one aspect of professionalism. So, to take that a step further, let's define professionalism. What is it? Well, what it means is it's the ability to demonstrate competency and skill expected of a professional. So, how do we accomplish therapeutic communication? Well, there are certain things that therapeutic communication requires. First, it requires clear communication of technical information. It requires adherence to acceptable social behavior. It uses specific strategies to encourage clients to express their feelings and ideas. These strategies may include some sort of physical touch, maybe a touch on the hand or a touch on the shoulder. These strategies may include some questioning strategies. It also includes both verbal and nonverbal communication. There are also professional skills that are involved. So let's take a look at some of those skills. First, let's talk about the skill of communication. Well, we just mentioned that therapeutic communication involves both verbal and nonverbal communication. And verbal communication includes what we say. It can even include what we write, such as our memos, our emails, or even text messages. So, verbal communication includes our words that we say and also our words that we write. Then there is nonverbal communication. And nonverbal communication includes our facial expressions. It can include our hand gestures or any gestures. It can also include our body language or our posture. It reflects our acceptance of our client. Both our verbal and nonverbal communication reflect that we do support and accept our client. It shows that we value our client. It expresses our willingness to help them. And then written communication, we need to make sure is clear and we need to make sure that it is also concise. And because that reflects on our facility's image, whether we're working for a clinic or maybe we're working for a hospital. Another professional skill is our presentation. How do we present ourselves? You know, research shows that it takes only 20 seconds to maybe 4 minutes to form an impression of another person. And this is usually due to that person's appearance. So we want to make sure that we are dressed appropriately, we are groomed appropriately. In addition to our physical appearance, our behavior and our conduct needs to be respectful as well. We need to be able to express kindness and caring and respect. Our client will be confident that his or her healthcare choice is the right one. They will also be comfortable, they will be valued, and they will also feel respected. Another skill that is really important in the healthcare field is empathy. Empathy means that we can identify with how our client feels, that we understand or we are trying to understand our client's perspective. This reduces their fear and it also reduces their anxiety levels. Overall, empathy has been proven that it provides better patient outcomes. And in addition to that, our patients are more compliant with what we need them to do. and our overall patient satisfaction is much higher. Attitude. Attitude is very important. We always want to make sure that we are promoting a positive outlook for our clients. Our clients, we have to remember they're not feeling well, they're worried, they're stressed. So we want to promote the most positive outlook that we can. We need to smile, we need to be happy, we need to be friendly, and we need to be cooperative. Be supportive. A positive and supportive attitude results in a much more compliant and a much more cooperative client. And then competency. We should be knowledgeable, skilled, and able to conduct our duties. So we want to always be sure that we're performing our skills to the best of our ability. Be dependable. We want to do what we say we're going to do. Show initiative and continue to learn. I always stress the importance of initiative because initiative is going ahead and doing something before someone even asks us to do something. And then focusing on that continuing to learn. Remember, in the healthcare field, it changes all of the time. We have medical advances constantly. Even look at our healthcare records. Years ago, healthcare records were written and in paper format. And now they're not, they're electronic. So we have to be able to constantly learn to keep up with those changes and keep up with those advances and continuously grow professionally. Doing these things and being competent, what it does is it helps our client feel safe and it helps them be more confident in our abilities to help them. And integrity. Integrity, simply put, is honesty, following moral and ethical principles. It also includes accountability. And accountability is just owning our mistakes and correcting them quickly, being sure that we're not blaming anyone else for our mistakes. We're human. We're not perfect. We're going to make mistakes. The key here is admitting to it, owning it, and then correcting it and learning from it. What this does is it builds trust and confidence with our clients. Remember, you're going to have access to very sensitive information. We're going to ask our clients very delicate, sensitive questions that require very sensitive answers. So we want to make sure that they trust us and they're comfortable and confident that that information is going to be kept confidential. Attention to detail. Complete documentation correctly. Remember that when you're documenting in a patient record, you're not the only one documenting in that, nor are you going to be the only one reading that medical record. We share those medical records with other facilities, such as a hospital or emergency room, or maybe if we are referring the patient to a different provider, such as a specialist. So we want to make sure that the information that we are providing them is legible and that it's accurate. And complete all tasks. Be sure sometimes we have several different things that are going on. We may be during the midst of a flu season and we have several patients and we have other things that we need to take care of as well. So we have to be sure that we're able to multitask and not leave any task behind and complete them effectively and correctly. And what attention to detail does is it improves the overall health care of our client. So those are some professional skills. Let's talk about some technical skills. So technical skills are specialized tasks that are required to deliver and support medical care. Now, these skills can be clinical skills, such as phlebotomy, maybe taking vital signs, or it could be administrative skills, such as filing. It can also include communication skills. So for this lesson, I want us to focus on the communication skills. So communication technical skills, they include skills that are used to explain difficult ideas and concepts. For example, medical terminology, conditions, treatments. Well, in the healthcare field, we're pretty well versed on those things. But to a patient, they're not. Or maybe insurance related information. If we're billing insurance companies, we're pretty well versed on that as well. We know what a PPO is or an HMO is, but our patients may not understand. They may not understand, why do they need a referral? Why do they need a pre-authorization? The key here is being able to communicate that information to them in layman's terms and in terms that they can understand. And then another communication skill is to be able to deal with difficult individuals or difficult situations. Remember, our clients, our patients are coming to us because they're ill or they have some sort of underlying condition. They're afraid, they have anxiety. So the key here is one is to understand their fear, understand their confusion, understand their frustration, and then reassurance. Reassure them that you're there to help. And then finally, acceptance. Accept where they are. So think of it this way. Here you are entering into a helping profession. So what is a helping profession? What do I mean when I say that? A helping profession is one that nurtures the growth and or addresses the problems of others. So how can we determine if we are well suited for the healthcare profession? Well, one, we've looked at a few characteristics of a healthcare professional. So now let's take a look at some questions that we can ask ourselves. How about this one? Do you genuinely enjoy helping people? You must really have a place where you're coming from that you really want to help someone and be able to show that compassion. Can you feel comfortable in a servant role? Do you genuinely enjoy serving the needs of others? Will you be able to treat patients as guests? Remember, our employment is dependent upon exceptional customer service. Patients are our customers. I think sometimes this is often overlooked in healthcare. Think about this. When you go to a store or you go to a restaurant as a customer, how do you expect to be treated by the staff there? It is the same with healthcare. When our clients and our patients come to us, they do expect to be treated as a customer. Customer satisfaction directly impacts the success of our clinic or our facility. In fact, there is something that is actually called value-based healthcare and value-based reimbursement. And what this means is our reimbursement, the overall financial success of our practice or our clinic can be determined on our customer satisfaction or our patient satisfaction. Are you able to accept differences? Our patients' personal lifestyle, their culture, their beliefs, they may be different from our own. That's okay. We need to be accepting of that, be tolerant of that, keep our own opinions to ourselves, be mindful of our own body language when we're presented with these situations. That's that nonverbal communication that we were just talking about a few minutes ago. Can you be firm yet gentle? Remember, patients are going to go through procedures that are going to be painful and they're going to cause discomfort. How can you handle those situations? Well, we need to be able to communicate the directions and what we need in a direct, firm manner. But at the same time, because they are afraid, because they are hurting, we also need to be able to come through with gentleness, such as the touch, the tone of our voice. Can you avoid codependent relationships with those you help? Avoid becoming hostile or angry with our patients over time. We are there to tell our patients what it is that they, or suggest, I should say, to our patients, things that they need to do, educate them on things that they need to do. But we can't make them do it. Remember, we cannot save everyone. So sometimes you're there to support, you're there to inform, and you're there to educate and answer questions. So try to be careful to not take all the weight on yourself if things don't go the way that they're planned. So, in summary, therapeutic communication requires clear communication of technical or confusing information, like we were talking about the medical jargon or the insurance information. We need to be empathetic to the patient's emotional state and accept the client's lifestyle, their cultural and personal beliefs, even if they're different from what we believe. All of these components improve our patients' overall health and emotional needs and outcomes. And that is the idea of therapeutic communication. So I challenge you. I want you to think of a time when you were a patient. Think of a good experience. Maybe you had a not so good experience. How did you feel? Did you feel like you were valued, respected? Were you comfortable? Were you comfortable talking to the healthcare professional? Did you feel like you were understood? Or even did you feel like they were trying to understand you? And then, as you're thinking about those things, consider this. What did the healthcare professional do that made you feel that way? How did their actions affect how you feel? Well, I hope you enjoyed today's lesson. Thank you so much.